Okay guys, today we're going to look at pain assessment. So pain is primarily a subjective assessment, so asking your patients all of the questions that we're going to go through. There are some objective things that you can do that we will touch on. So let's just go through a little scenario with our patient. So as usual, we're going to wash our hands using our hand sanitizer. We're going to enter our patient's room. Good morning. Good morning. How are you doing?
I'm all right.
Yeah. What's your name?
Linda.
Hi, Linda. My name's Rebecca. I'm going to be your RN today.
Okay.
How are you feeling?
Pretty good.
Pretty good. I'm just going to check your armband. Can you tell me your full name?
Yep. Linda Kavanaugh.
And what's your date of birth?
25th of September, 67.
Perfect. How was your night? Did you have good sleep?
Not the best. The pain is kind of keeping me a little bit awake through the night. So
Okay.
not the best sleep.
Okay. So, do you have pain?
Yes.
You do? And where is the pain located?
It's here in my right elbow.
In your right elbow.
Yeah.
Okay. So as a nurse, we can go through a number of different questions to examine that pain further. So we use an acronym PQRSTU. So we'll start with O, which is onset. So when did the pain start, Linda?
So it started about 4 days ago. I was just playing, 9 holes, like just kind of practicing.
Okay.
And I kind of felt like a little tweak in my elbow. It didn't seem that serious at the time, so I just kind of finished playing. That night, it got a little bit more sore, and then by the next morning, it was really quite sore, and
Aw.
it's kind of stayed that way.
Is that right?
Yeah.
And is that what brought you to hospital?
Yeah.
It is, yeah. Okay, so they're checking that out for you.
Yeah.
Okay, so that is your O. So P stands for provocation and palliation. So you're going to ask your patient questions. So what happens, like what makes the pain worse for you?
So really just kind of any type of movement.
An activity and
Yeah.
things like that.
Yeah.
And is there anything that you've been doing that relieves that pain?
So I've been using some ice, kind of like keeping it a bit immobile, and just taking some ibuprofen.
Nice. Okay. So yeah, this is an opportunity if you have any other suggestions too for patients of other things that they can do to help alleviate that pain a little bit. So Q is our next question. So that stands for quality. So if I could ask you, Linda, how would you describe your pain?
So I would say it's like it's like a toothache in my elbow.
Okay.
Right? So it's kind of throbbing. It's quite aching. If I move it, that pain becomes kind of sharp.
Okay.
It's not like that ache. It's like you can notice it right away. It's like, ow, like someone just kind of
Yeah.
stabbed me in that elbow.
Okay, so when patients are telling you about the quality of their pain and using those descriptive words, those are really important when it comes to your documentation because you can actually use those words to describe that pain. Patients are typically going to say things like dull, aching, sharp, burning, so those are typical responses. So that is Q. Now we're moving on to R, which stands for region and radiation. So Linda already told us the region is her right elbow. Linda, does the pain go anywhere else? Does it radiate maybe up to your shoulder or down to your wrist?
Yeah, it's funny that you asked that because I just kind of started noticing that this morning that, at first it just kind of seemed to be my elbow, but now it kind of seems to kind of be moving down a little bit to my wrist. I don't know if that's because I'm not moving my arm at all, but
It could be.
now that you mention that, yeah, it is kind
Yeah.
of moving a bit.
And sometimes that's typical of pain. It may start in one area and then move to other areas. Okay, so we looked after that. S stands for severity scale. So I'm going to ask you to rate your pain, Linda. So typically we use a scale from 0 to 10. 0 would be no pain at all, and 10, if you could think of the worst pain you could imagine, that would be a rating of 10. So where on that numerical scale do you think you would put your pain right now?
Right now, I'd say it's probably about a 5.
About a 5. And then what if you got up and you were moving that arm? Do you think it would
Oh yeah.
it would
yeah,
go
like
up?
just kind of any little bit of activity makes it worse.
Okay, so when you're assessing that severity scale, it's important to ask the patients. A lot of times I'll ask them, what is the rating right now at present at rest, and what would be the rating with movement or activity? T stands for timing. So how long has this pain been going on?
So I would say the past 4 days.
4 days.
Yeah.
And is that pain constant or is it intermittent? Does it come and go?
So I think like the pain is always there, but the severity changes. Like sometimes, like last night, for example, I woke up and it was throbbing. I was probably about an 8. And then I had some medication this morning, so it's about a 5. So it's kind of always there, but it's not always like really, oh my God, it's really hurts.
Right. Okay. And then finally, U stands for understanding. So your understanding of pain. So you can ask the patient, how is this pain affecting your day-to-day life? Is it affecting your activities of daily living? Are you having trouble with
Yeah.
anything like that?
So, well, it's really affecting everything. So, because my job, I need I need movement of my arm, and
Aw.
so I'm really struggling kind of, getting my work. I can't like just even like getting at the computer.
Okay.
It's really, really affecting my sleep. Like I feel like I haven't slept in 4 nights.
Aw.
And then of course, just have a hard time getting myself dressed. And I mean, I can brush.
Yep.
Can brush with my left hand and button with my left hand, but just even getting myself dressed and
Just all that day-to-day
just,
stuff.
like
Yeah.
everything that you do in a daytime. I
Yep.
can't lift my little fella, and so my partner's away, and so kind of being a single parent right now makes it a little bit.
It's definitely
a little bit harder.
challenging. The other thing I usually ask patients when I'm asking them about their pain is, do they have any other symptoms that accompany that pain? So a lot of times patients may have nausea, they may have headache, and then asking them, how they feel about it. They may feel, like Linda just expressed, she has a lot on her plate, so that may make her feel some level of stress or worry or anxiety. So you can always ask your patient those questions as well. So how are you feeling about this?
Just frustrated. Like
Yeah.
it's not great timing. I have stuff to get done, so
Yeah.
just really hoping that it's nothing serious. I'm hoping
Right.
it's just maybe a tendinitis, but
Mhm.
hopefully nothing serious, and
Yeah.
just I can get back to my normal life.
Absolutely. So we're going to do everything we can while you're here to make sure that you're as comfortable as possible. You mentioned you were getting some medications for pain, so just encouraging your patient that if they feel that they need something for pain, to be ringing their call bell and asking the nurse for that, and we can administer medications as ordered. Linda, now can I just have a look at your elbow?
Sure.
Just to have, so that's pretty much your subjective assessment of pain. So this is just a brief objective assessment. We are going to do a full musculoskeletal assessment later on in the lab, but just for a quick examination, so thinking of your inspection, your palpation, your auscultation. So in this case, an inspection. So we're just looking at Linda's arm. So you can see her upper arm, her elbow, and her lower arm, her wrist, and her hands and her fingers. So I'm just looking. I don't see any obvious redness, discoloration. There's no bruising that I can see. There's no obvious deformity or swelling. There very well could be those things, but I'm not seeing anything right now. You can ask the patient to do just some passive range of motions. Linda, do you mind moving your elbow up and down for me? Are you able to do that?
So active
Active.
range of motion.
Right. So are your active range of motion, getting the patient to do it themselves?
Yeah, so it's a little bit sore. I mean, I can do it, but it's so kind
It
of right there.
is.
It really just kind of starts to hurt.
If the patient, for whatever reason, couldn't do that themselves, you can assist them, and this is what's known as passive range of motion. So I'm just seeing to see that that patient can move that that joint easily, and there's no, pain or difficulty or discomfort. And you're going to do that for the elbow in this case, and down at the wrist where she said that that pain is radiating down her arm. So you can do the same thing, get her to move her wrist around, wiggle those fingers, and all of that. So we will go into the more detail as the lab progresses, but that would just be a part of your objective assessment for that elbow there. So that's your inspection. So palpation, I'm just going to take my hands and I'm just going to palpate. So her skin is warm, it's dry, there's no obvious swelling or deformities. You're just going to palpate all the way down the arm, down to the wrist,
Yes,
the
really
fingers.
tender when you touch
When
it,
you
yeah.
touch, mostly around this area?
Yeah.
Okay. So this is all, guys, really important for your documentation, to be keeping note of what you're seeing, what you're feeling, and what the patient is describing. So Linda, is there anything I can get you before I take off?
I noticed one of the nurses last night gave me an ice pack.
Okay,
So,
sure.
You know, the medication does so much, but like an ice pack really helps. And the other thing was, I don't know who, if there was a nurse yesterday, and she actually brought in, she showed me on my phone like a little app that kind of has some calming music, and I actually
Oh, nice.
found
Okay.
that was quite helpful too.
Sure. Okay, let me go get that for you.
Okay.
All right, I'll be right back. And then you're going to wash your hands upon leaving. So that is a very, in-depth, subjective, and just a little bit of an objective assessment for a patient that is experiencing pain. So let's just reset and go back in the room, and we'll show you an example of what a pain assessment would look like for a patient who has no pain at all. So again, we're going to wash our hands, and we're going to go back in the patient's room. Hi there, how are you doing?
Good.
That's good. My name's Rebecca. I'm going to be your RN today. What's your name?
Linda.
Hi, Linda. How you doing this morning?
Pretty good.
You're okay? Yeah. I just wanted to check in with you. Are you having any pain today?
Nope.
No pain at all?
Nope, no
Have you
pain.
been having pain since you've been here? Any issues with that?
Nope. No pain.
No? Feeling good?
Yep.
Yeah?
Pretty good.
Okay, that's great. If you do have pain, you just let me know and we can
Okay.
look into that a little bit more.
Okay.
Is there anything I can get you?
Nope.
No, you're good? All right, we'll see you later. And that would just be the end of that. If your patient doesn't have any pain, you're asking them, those simple questions, and if there's no pain, you can just kind of leave it at that. Right.